Welcome to DermTV Viewer Question Week for August 2012. Today's episode will feature questions from DermTV YouTube viewers. And don't forget, as part of Viewer Question Week, I'll be answering viewer questions over live streaming video at beautyrxlive.com. So if you have a question, tune in this Wednesday at 2 p.m. Eastern Standard Time. Hello, I'm Dr. Neil Schultz, and welcome to DermTV. Today's first question comes from Velvet Tulip EMJ. I really respect what you do and all your knowledge. Thank you very much. But I think you're going a little far scaring people off of using soap bars. Certainly not my intention. I make soap. I have for years. First, there's a huge difference between tensioactive substances made soaps and cold processed soaps, for example. Again, I have a lot of respect for everything you do, but to me this is being a little paranoid. But I do agree with you that to keep a soap clean, you're better off having a soap dish that enables excess water to fall out. Really, that was my intent. Not to scare anybody, not to be paranoid, but just to explain how you can go one extra step to make sure that soap, which we think is the solution and answer to preventing infections, to make sure soap doesn't cause an infection. So there was no need for alarm, and I just wanted to point out that it is important, whether it's soap or anything else that you use for washing, that if it's allowed to dry out, it's much less apt to harbor any germs. And I'll tell you a little secret. For my entire life, I've used a bar soap in the shower on my body. And no, I've never gotten an infection from a bar soap, but I do make sure that it's put in a place where it can dry. So thank you very much. Next question is for KMK752. What are your thoughts on threading? Well, threading is a terrific way for removing excess hair, particularly if it's not dark hair, if it's light-colored hair, which doesn't respond to lasering. But don't forget, threading is another form of plucking. And any form of plucking can set you up for ingrowns, as I've mentioned many times on DermTV. So in terms of plucking hairs, whether you use a tweezer, whether you're waxing, whether you're having threading done, they all have the same risks of causing ingrowns. Amongst those different techniques, which sometimes are necessary because other techniques aren't suitable, such as laser hair removal, which is only suitable if you have dark hair, not light hair. So if you have blonde hair or gray hair that you need removed, then waxing or plucking or threading is an appropriate way of doing it. And certainly skilled threaders do it very quickly, they do it painlessly, and they do it skillfully. So certainly no objections on threading if that's the type of hair removal that you need. Next question comes from Mala's Babe. I have a few red moles. Should I be worried about these? Well, actually, really red spots on the body usually aren't moles. They're usually what we call cherry hemangiomas. And they're sort of either flat to dome-shaped, very small, 1/16 of an inch, and they usually appear in many different places, and they're hereditary, and we usually know which one of our parents we got them from, because we remember which one of our parents had many of these, and again, they're hereditary. They're not dangerous. The only time we ever do anything about them is if they're cosmetically objectionable or if they're in an area that's getting rubbed. Because if it gets rubbed, they can bleed. And when they bleed, because they're really just enlarged blood vessels, they bleed a lot and it gets a little scary. So what I think you're talking about by red moles is really these cherry hemangiomas, completely harmless. Most real moles are skin-colored to tan to brown or even black, but not red. Our next question comes from MZ Ray. Greetings. I've had freckles since I was in kindergarten and have acquired more throughout the years. But I have a feeling that some of them are not freckles and instead are sunspots. How can you tell the difference between a freckle and an age spot? Well, you're correct that age spots and sunspots and liver spots are all the same. And the way we distinguish between freckles and the other three, which again are all the same, real freckles will get darker in the sun and lighter in the season when there's not as much sun. And they tend to be, of course, on areas which are frequently exposed to the sun. Sunspots, on the other hand, also called liver spots or age spots, as they accumulate, they don't go away. They just get slightly darker, slightly larger, and you get more of them. but they don't diminish when you're in a not so sunny season. Also, these sunspots, these age spots, they don't really occur in teenagers. They barely occur in people in their young 20s, and usually they don't start to occur until your 30s and older. So real freckles, darker in the sun, lighten up somewhat in a not sunny season, and age spots, once they're there to stay. Good news, neither of them are dangerous. They're both of only cosmetic importance, and the age spots, believe it or not, are easier to get rid of than our true freckles. Lilione asks, how often should I wash my hair? Well, it's really not your hair that you need to wash with great regularity. It's really your scalp. So when patients come into the office and they tell me, my scalp itches, and I say, how often do you wash your hair? And they say, about once a week. I tell them, if you only washed your hands once a week, I bet your hands would itch also. You've got to get rid of oil, dirt, debris. Well, same thing with the scalp, and particularly the scalp because there are lots of oil glands. The oil glands make oil, which number one is a coating in and of itself, and number two, the oil helps hold on to dirt. So you really need to wash your scalp anywhere from every day to every other day. And some people can get away with every third day, but most people, every other day is a reasonable frequency. And again, you're washing your scalp, it's not really so much the hair. If you have very oily hair, then of course the focus is also at washing your hair. But we're talking about every day to every other day. And it doesn't make your hair fall out. You normally will have a few hairs falling out after you wash your hair. And that's because these are hairs that were ready to be shed. Don't forget, you're supposed to shed 100 to 150 hairs every day, which you don't see all of them because some of them fly off in the wind. But as long as you're growing 100 to 150 hairs every day, you're in balance and you're not, quote, losing hair. Next question comes from Audio GGG. Can you give us tips on the safest way for fair-skinned people to get tanned? Sure, that's easy. Use a self-tanner. You've heard me say many, many times that there is no safe tan from the sun or a tanning salon. Anytime you do get tanned from ultraviolet exposure, that tanning means your skin has been injured. And when the skin is injured, it leads to two things. Either degenerative changes like age spots and sunspots or lines and wrinkles, or else to precancerous changes like keratoses or dysplastic moles, which ultimately can and do go on to become skin cancers. So in answer to the safest way for fair skin, or for that matter, anybody to get tanned, there's only one relatively safe tan, and that's the tan that comes out of a bottle, a spray tan, an artificial tanner. I used to say that was a completely safe tan. And today I say, certainly it's a much safer tan than an ultraviolet-induced tan. And we've addressed that difference in another episode. Audio goes on to say, I'm pretty pale and I can get a darker skin tone without getting a painful, and I can't get a darker skin tone without getting a painful sunburn. Well, that's exactly the point. And that sunburn is an injury which is then causing a temporary tan. And goes on to say, and the tan doesn't even last a month, and I know is dangerous for me. Okay, so I guess we've summed it all up. Ultraviolet tans are dangerous, whether they're from the sun or a tanning salon, and a safer, much safer tan is from a bottle, an artificial tan. Rage Your Mommy says, what's your opinion on the new vaccine available to avoid shingles? I'm a very big fan of it. It's approved for people age 60 and over, and anybody age 60 and over who's not had shingles should get the vaccine. And it's also been demonstrated to be safe even in people age 50 and over. So whichever of these age groups you fall into, I do recommend, after checking with your doctor for your personal circumstances, that you do get the shingles vaccine. Lastly, I would like to thank you. I'd like to thank all of you, but in particular, I'd like to thank Shopping Star 525 and My Sly Slies, who both have said such wonderful and nice things about the DermTV series. And I know many other people have said very complimentary things, and I appreciate all of your support. But I just wanted to bring to your attention these two particular viewers who made really nice comments to the effect of that this is the best channel ever. We work very hard to ensure accuracy, to give you really good information, and to try to help clear up a lot of misinformation that's available out there. So, that's it for today. And don't forget, the subjects from so many DermTV episodes come from your questions, which are really so great. So please keep sending them in, and I'll keep answering as many of them as I can. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.